So, I normally teach courses on medical communication, continuing education, doctors, nurses, MDs, psychiatrists primarily as an acupuncturist. And it's usually on nonverbal medical communication, which is a little unusual, I know. And yet, I'm speaking out loud, so it can't be too nonverbal, right? So perhaps I would call it unconscious communication. I'm going to talk about, we're going to experience the impact of your communication, the unconscious parts of what's happening while you're interacting with somebody. And in talking about communication, people often go, oh, I'm a good communicator already, I don't need that crap. I agree. I like to say that I start off with an assumption, and I'm going to start off with that assumption in this room. Are all of you in clinic? Anybody not in clinic anymore, or not yet? So my assumption is that every one of you is already an exceptional communicator. Make no mistake about it. If you got this far in school and in your lives, you have friends, you have families, you have people that you meet all the time, and once you're in practice, every day in the clinic you're going to be meeting people you've never met before. We get to meet, if I may see 10 or 15 people, whatever, in a day, and 10 or 15 times I'm saying hello to somebody where other people have desk jobs where they're, not going to meet all that many people. So my assumption is that all of you are already exceptional communicators. And if I were to ask any one of you to spend 5 minutes telling me in words how it is that you are able to get in rapport with somebody, I'm sure that you could do that really well, that you could tell me how it is that you get rapport. So, what if I were to ask you to spend 5 minutes telling me how it is you get in rapport with a patient, but for only 30 seconds of that 5 minutes could you actually use your words? Once you do that, you might start off with that 30 seconds saying everything you needed to say to tell me, and then after that you might have to just move your body in a funny way, or might be like some kind of mime experience or interpretive dance. Don't worry, even though I just drove down from Berkeley, I'm not going to start us off warming up with some interpretive dance on communication. I don't need to actually, because you're all doing that right now already. As you sit here, looking at me, looking down, eating, drinking, whatever you're doing, whatever is on your mind is already on your body. How many of you have heard that statistic that up to 93% of communication is nonverbal? Yeah? So if only 7-10% is verbal, the rest of that has to be your posture, your movement, the way you breathe, the tone of voice, all of these other things that are actually determining the vast majority of the impact we're making in communication. So what's the significance of that? Well, if you're already an effective communicator, whether you're in the clinic or in your lives, and most of your conscious communication is coming from your ability to verbalize your talking, then just imagine how much more effective you can be in the clinic and elsewhere when you can take a bigger chunk of that remaining 90-93% and actually consciously be aware of it and be acting on it. And that's what I am going to talk about a bit here today. And by the end of my time here, and I don't know, it just disappeared, so I don't know how long I'm supposed to be here, but I'll blabber on until you all get bored. I expect that none of you will be bored because you're going to be interacting a large part of what we're doing. And by the time I leave, I expect you all to have some great tools that are going to help you really get in touch with that nonverbal piece and get great rapport with just about anyone you meet. And it's especially important in the clinic, as we'll see. So I should give you a little more background on why I'm here. Like all of you, I'm really into Chinese medicine. And it's my passion and goal to help create a world where what's currently considered an exceptionally effective medical treatment becomes standard of care for everyone. And in order to make that goal my reality, I spent much of the last 15 years seeking out practitioners who consistently get exceptional results. And I found that they all share some common ways that they get improved outcomes and happy patients. And since this is a practice management course, regardless of all the piles of paper you get and stuff like that, I know Marilyn likes to hand out a lot of stuff. I can talk crap about it much. The number one way to get a healthy practice going is to get your already happy patients to send their friends and family. Going many of you, when you first are about to see a patient, especially someone you've never seen before, your heart rate goes up a little bit, or you get a little bit nervous, like, oh, I'm going to have to do the acupuncture case now. To convince them of something. Anybody have that experience? You get a little bit nervous when you're about to see somebody, or maybe you've already seen someone and they're coming back for the first time after they've seen you. It's been a week or whatever, and before they say anything, you're like, oh, I really hope that they felt better. Yeah? Just before they open their mouth, you're like, oh, I hope the first thing that they say is, oh, I feel so much better, instead of like crap. That's what I mean by hope. I don't want to have to rely on hope and get my heart rate go up every time I see another patient, because I'm hoping that whatever this stuff I did works. And the dirty little secret is that all of us rely on hope to some degree in our practices. No matter how confident someone appears to be in their acupuncture, or their surgery, or their chiropractic, or their physical therapy, or any of it, all of us practitioners all rely on hope to some degree. In fact, when she's out of the room, I can tell you, how many of you have ever seen those little, those things around the license plate that some acupuncture people have that say acupuncture, it works? You ever seen those license plate frames? I'm just talking about your license plate frames.
Oh, the one with
the acupuncture, it works.
Yeah.
Yeah, so was it 10 years ago or something? When people interacted with Maryland, they would get these, who got those? Was insurance?
It was, well, we worked with the state association. If you joined the association, you got free.
Yeah, so you get, have any of you seen those license plate frames that say acupuncture, it works?
I haven't.
Yeah, so there are a lot of them out and around. Years ago, Maryland helped just get those out into the world. And the funny thing to me is, I think they should say acupuncture. I really hope that it works. Because we're hoping so much. And the funny irony there is that the only people with those license plate frames are acupuncturists. So, in any event, hope is a big part of our practice. And I think it's appropriate, you know. Hope has a place in practice. Belief has a place. And, you know, I think while hope may be, you know, a great way to get to higher political office, I don't want to have to rely on hope when I'm treating my patients. And, you know, if I were to see a surgeon who's going to do surgery on me, I don't want that surgeon looking into my eyes as I'm about to go under, really hoping that what he or she does works. Got to be more than that. And so what I did was I started studying with anybody I could find who got exceptional results. Doctors, surgeons, chiropractors, physical therapists, acupuncturists, herbalists, Maryland, even a Taoist priest who actually co-founded this school, and medical philosophers and all of that. And how many of you have ever had mentors? Whether it's in this area or something else. You know what you do when you have a mentor? You first have a mentor relationship. You follow this person around and you try to figure out what is their secret, what is it that they're doing, what's the secret sauce, you know, what's that secret technique that they've got. And you imitate it, right? Well, with this, you know, Chinese medicine, I had my mentors and I kept trying to imitate them, whether it was Richard Tan or Machiojo with his herbs or whatever. And what I eventually found was that what they did, you know, I get varying levels of success with imitating their techniques and their herbal prescriptions and all of that. What I eventually found was that what they did mattered so much less than how they did it. Every practitioner may have had their secret little technique or whatever, but what they all had in common, whether they were doctors or acupuncturists or physical therapists, was that they're all able to get a deep connection with their patients, almost all of their patients, to get deep, rapid rapport with just about any patient. And perhaps most importantly, more than anything that I say beyond this, is that they were able to get their patients to they didn't move their patients so much away from disease as toward health. That's a very important distinction. The best practitioners don't move their patients away from pain rather than toward health. And we'll go into that further. So, as it turns out, if you study, look at all the studies. Having just come from the medical school, they wanted all of the evidence, so I had to do a lot of research to make sure that everything I was saying actually had a basis in fact and all of that. And if you do research on medical effectiveness, it turns out that the most effective practitioners, and this is especially in the studies of Western medicine, aren't the ones who have the highest level of skill. They're the ones who get the deepest, most rapid rapport with their patients. So when you get deep and rapid rapport with your patients, all the research shows that you'll actually get much improved outcomes based just on your ability to communicate, not necessarily your technique. You'll be better at getting great diagnosis and treatment results. You'll also have happier patients, which means you'll be happier in your practice as well. How many of you ever thought that you might get compassion fatigue? That's what I call it. Yeah, and if we can just mirror our patients enough to feel their pain, then we can really help them. Oh, that's tough. I sound like a jerk, but it's, when I was in the clinic, I went to this Oakland Chinese school, and we had these 4-hour clinic shifts, and I would see one patient with a migraine, and I'd have to go home with a migraine. Or I'd have one patient with stomach ache, I'd get the stomach ache after treating them, and it took me 2 years to do my, something that should have taken me 1 year. I don't want to have to deal with that. So, as it turns out, if you're able to use some of the techniques that we're going to talk about, you don't get that compassion fatigue. And as Marilyn knows as well, when you have happy patients, you also don't get sued very often. You know the number one reason why people have malpractice suits against them? Yeah, it's not because of their technique or they made a mistake, it's because the patients don't like them. If someone doesn't like you and you screw up, you're going to be much more likely to get sued than if they like you, you screw up, they're like, oh yeah, well, that happens, you know. So, all of these things, all the research shows that if you get great communication with somebody, you're going to get all of these benefits. But rather than baffling you and dazzling you with a bunch of evidence, and rather than standing up here talking the whole time, I'd rather you guys have some experiential things happen here so that you get in your muscle why this is important and some of these skills that we're going to build on. So what I'd like you to do is sit up in your chairs for a moment. If you have something in your hands or on your lap,